Kia ora koutou, good afternoon everybody. I'll begin with some good news that once again today there are no new cases to report in the community and just one case in managed isolation. We'll get into the usual daily update shortly, but first we turn to our vaccination program. As of today, 18,000 people will have received their first doses of first dose of the Pfizer vaccine, with the initial focus having been on our Covid-19 frontline border workforce and now on their families. Yesterday afternoon we received the fourth batch of our Pfizer BioNTech vaccines. That shipment of around 64,000 doses arrived as air freight at Auckland International Airport, bringing the total number of COVID vaccines we've received so far to around 265,000, enough to vaccinate more than 132,000 people with the 2 doses required to get maximum protection. All of this has us in a very strong position as we move to provide details of the sequencing of our vaccine rollout, the focus of today's announcement. So today I'm announcing a targeted rollout over the next 3 to 4 months, initially focused on the 2 million New Zealanders most in the most at-risk groups. These are the New Zealanders most at risk of getting and spreading COVID-19 and those most at risk of getting seriously sick from it. Our plan also has a focus on those who live and work in places where they're most likely to pick up COVID-19. I can confirm that over 65s and those with underlying health conditions in South Auckland will start being vaccinated from the end of March. This plan further reduces the risk of future outbreaks, something that's been central to all of our government planning and prioritisation during the pandemic. We've been able to fully focus on this plan and the sequencing framework after securing enough Pfizer BioNTech vaccine for everybody in New Zealand to get 2 doses that they need to be fully vaccinated against the virus. It's a balanced plan that prioritises reducing the chance of future outbreaks whilst protecting our elders, those with underlying health conditions, and those who live in locations where we know outbreaks have occurred. We've seen the devastating impact that outbreaks in residential care facilities can have here and overseas. That's why this group of New Zealanders will start getting vaccinated later this month. Then all older New Zealanders aged 65 and over will be prioritised to start getting the vaccine from May. The vast majority of our COVID deaths have been people aged over 65, and we do note that that is a critical group to get vaccinated early. It's estimated that those over 65 have a 5-fold increase in risk of severe health outcomes if they were to get COVID-19. So there are 4 main priority groups. Group 1, where we're well underway, is our 50,000 border and MIQ workers and their household contacts. This started last month, and the vast bulk of that phase 1, that group 1, will be completed this month with at least their first dose. Group 2 is approximately 480,000 frontline workers and people living in high-risk settings, starting with 57,000 healthcare workers on the community front lines, and then moving through healthcare workers protecting our most vulnerable and some of our priority populations. This work also started in February and will continue through May. Group 3 are our priority populations. So this is approximately 1.7 million people who are at higher risk if they catch COVID-19. That group we plan to start vaccinating in May. And then Group 4 is the remainder of the New Zealand population, the approximately additional 2 million people that can expect to start seeing vaccines available to them from July. I want to be clear here, some of these dates may overlap and shift slightly as our modelling continues and also as we get greater certainty of our delivery schedule for vaccines, and conversations with Pfizer, particularly around those big bulk of deliveries we're expecting in the second half of the year, are ongoing. I want to reinforce that every New Zealander will be able to get a vaccine and that the vaccine will be free. The rest of the population will be able to be vaccinated from July onwards, and our plan is to have as many people as possible vaccinated by the end of the year. In further detail, approximately 40,000 courses are being allocated to our Māori and Pacific health providers who are working directly with older people, and as I've said, we're also recognising special circumstances in South Auckland. Anyone who lives in the county's Manukau DHB area who is 65 and older, or who has an underlying health condition, is in Group 2. This recognises that there are many border operations and MIQ facilities and their workforces that are based in this area, and therefore they are at increased risk. There are two further categories that we are still working on. One for people who may need to get a vaccine on compassionate grounds, and one which we're calling the national significance category, which could include people who need a vaccine in order to represent New Zealand overseas. Decisions around these categories have not yet been taken, but I will be taking more detailed proposals on those to Cabinet in the coming weeks, and we will share those as soon as those decisions have been made so that people can transparently see who is getting a vaccine and why. In closing, the message here is simple. This plan reinforces the importance of New Zealanders getting vaccinated. Getting vaccinated is the best way to protect our whānau, their lives and their livelihoods. The biggest factor in lifting COVID-19 restrictions will be timely and high uptake of vaccines. Again, it takes an enormous amount of work across a very wide range of people to roll out an immunisation program of this size, the largest such undertaking New Zealand has ever undertaken. And I want to thank everybody who has been involved in getting it to this point and who will be involved in the work that we take forward from here. I'll now hand over to the Director General for a few of the daily updates, and then we'll take your questions.
Thank you, Minister. Kia ora koutou katoa. So just a few additional comments on vaccines. It's pleasing this week to have started into that next phase officially of the immunisation program, which is the wider families and whānau of our border workers. Yesterday, earlier this week, the first large-scale vaccination clinic opened in South Auckland at the start, or as part of that official approach to vaccinating household members of border workers. And initially there will be about 150 people a day through that clinic, and scaling up very quickly to increase the numbers over the coming week. And the idea is that this size clinic will be able to put through around 1,000 people a day. Two other large-scale vaccination centres will open, one in West Auckland and the other in Central Auckland in coming weeks, and they will also initially focus on those household members, and then of course be used as we move down and out into those other groups. We're also partnering with Māori and Pacific providers to set up smaller community-based vaccination clinics in South Auckland to support the rollout. Across the country, 14 DHBs are now vaccinating, and more than 900 vaccinators have completed the bespoke COVID-19 vaccine module required of them in order to administer that Pfizer-BioNTech vaccine. This specific training module includes how to handle and give the vaccine, as well as information so that vaccinators can in turn answer the questions of the people who are coming to be vaccinated. Just a couple more comments on the daily update. As the Minister mentioned, there is one new case of COVID-19, a person in managed isolation who returned from the United States and tested positive at that routine day 01 testing. That person is now in the Auckland quarantine facility, and there are no new cases in the community. An update on the aircrew member that tested positive at the weekend. All close and other contacts to date have returned negative results. That includes family members and other members of the crew that came back on the flight from Japan with this crew member, and there are no new locations of interest. We're continuing to work with Auckland Regional Public Health on possible sources of this crew member's infection. I'm pleased to report that the outstanding gym goer from our Auckland February cluster or outbreak has been contacted, was tested last night, and has also returned a negative test. So our total number of active cases today is 80, and the total number of confirmed cases since the start of the pandemic in New Zealand is 2,054. Yesterday, our labs processed 8,618 tests, and our grand total to date is now 1,795,324. And so far, we have also had, since the 1st of January, 37 historical cases out of a total of 243. Thanks, Minister.
Gina.
As for compassionate and national significance categories, I appreciate you haven't decided who will be in those, but what is the sequencing of those? Will they be available at the same time as Group 2 or Group 3?
So that's one of the decisions that Cabinet will have to take, as to exactly where they sit, or whether that's a continual availability for those groups. That's a decision that's yet to be taken.
Should it be that they are vaccinated before Group 3?
Look, again, like I said, that's a decision that's not yet been taken. We'll work our way through that, and we will share that, because it's important that people know exactly how we've prioritised. We have not made decisions on that particular group yet.
Why have you not made decisions on that? Is this compassionate grounds in this national significance category just not something you'd thought about?
No, it will be a relatively small group of people that we're talking about here. They'll be the bar to access a vaccine under those criteria will be a very high one, and so that's actually the work that we're doing now, is just to make sure that we get that sufficiently tight that it's not open to abuse.
Bank of New Zealand is the only information they're getting today is that from July until the end of the year you'll be getting a vaccine. When will they have more certainty, and how will you prioritise those 2 million people in that fourth group?
So as we get closer to the middle of the year, and probably closer to May, actually, when we start to really ramp up in anticipation of the bigger rollout from July onwards, we will be able to share more information, including things like details of of larger scale events where we'll be making vaccines available to a large number of people in locations. We'll be able to share that more towards the beginning of the year. But
Or how will that work?
again, that's something that will partly depend on deliveries and when we get greater certainty around that. At the moment, the team are working with Pfizer, and we have reasonable sort of certainty around exactly what's getting delivered roughly 6 weeks into the future. But we're aiming to really kind of get more detail around that. We are confident, though, based on discussions so far, that we will have our full allocation of Pfizer vaccines in country well before the end of the year. So we're confident of that based on our discussions, but the exact sequence of when they arrive are still being locked down.
How far will your existing stock take you to right now? Like the amount of vaccine in the country right now, how far will that take you to?
I think I mentioned that in my introductory notes. We've got 265,000 doses, so that's about 132,000 courses, or 132,000 people who can be covered by that. But we are expecting regular shipments. Broadly, I mean, you will have seen that the last few shipments have been around that kind of 60,000 mark, 50 to 60,000 mark. We're expecting regular shipments to continue over the next period of time, and we are expecting the full 250,000 courses to arrive in the country over the coming month.
The prioritisation of aspects of the South Auckland community, I mean, surely that's more to prevent sort of severe harm, less than actual outbreaks within that community, because it'll be less than half of the DHB population that you're vaccinating at that stage. Why not vaccinate more and really protect against outbreaks?
Look, it's a combination of things. As I said, we obviously want to reduce the risk of outbreaks, but we also want to reduce the risk of people being adversely affected. One thing I do want to say at this point around the table that you have all been given is that the lines, the horizontal lines, are not absolutely hard and fast. So, for example, we would not necessarily say we have to do absolutely every one of the 57,000 people in Tier 2A or Group 2A before we moved to Group 2B. If, for example, a frontline non-border worker, health worker, presented for vaccination in that Tier 2A group, and they had a close household contact who was more at risk, who was in the Tier 2B group, it may well be that they both get their vaccinations at the same time. So we're already seeing a little bit of movement around that. For example, as we've been doing our border workers, they were our first priority. When they reached towards the end of the day, if they had extra vaccines that were made up that they hadn't yet used, they would start vaccinating the frontline health workers with those extra doses. So we don't want to lose, we don't want to waste any vaccines. So that's also part of our consideration. So this is the broad grouping, but there's discretion to have slight movement within that.
Yeah, but why was the decision